Hello everybody, welcome to BDNers Corner channel. Yet another exciting topic which we are going to discuss now is that it's the pulse, which is not normal, but it's the abnormal pulse. Whenever we, being the student nurses, when we are posted, you have to ask when no on the abnormal pulse. So, not wasting your time, let us move on to the abnormal pulse. So the abnormal pulse here I have given along with the waveform and in what are the conditions it may be appearing, how the characters of the pulse appear, and the defined terminology. In case of a normal pulse, the patient will be exhibiting regular, even, and intensity of the pulse is going to be very much regular. And of course, the waveform is depicting in such a way that there is a good peak from the isoelectric line, and you can see the curve is very much regular. So mostly conditions with not of any sort of cardiac conditions, patient is going to have a normal pulse. The next type of abnormal pulse is that diachrotic pulse. So this diachrotic pulse, you can see the waveform, that is, there is a small depth in between each beat, and you can see there is a big low amplitude which is going down, and again you have two each beats. So the character of the pulse will be appearing, that is the systole, there is a percussion wave, and there is a diachrotic wave in the diastole. So here there is a bifid pulse, or you call it as the two pulse being felt. This is mostly seen in case of patients who are having high systemic vascular resistance, or might be if there is a very low cardiac output, or might be patients who are being suffering with severe sepsis. On the third, you have the thready type of pulse, where the intensity of the pulse is said to have been 1 plus. There is the pulse wave is being waxed and wane, so you are not able to see the systole and the diastole, where there is a wavy movement, which is very much thread-like pattern. And this thready pulse is mostly seen or observed in a case with shock or severe peripheral vascular disease. The third type of pulse is bounding pulse, where the intensity of the pulse is said to be 4 plus, easy to palpate just you when you touch over the radial artery or might be the brachial artery, you are able to palpate the pulse, and it's very difficult to obliterate, where you can see the systole and the diastole, there's total differences. So this bounding pulse may be due to age-related factor, or might be a patient with anemia, or might be patients with high cardiac output, or any case of aortic regurgitation, or in case of any hyperthyroidism. The fifth type of pulse is bifrenance, where there is two systolic peak. You can see the two systole arch with the dip in the diastole. So this is mostly seen in case of any valvular defect, such as in case of aortic regurgitation, or might be in case of any aortic regurgitation combined with aortic stenosis, or it can be also seen in certain cases of heart failure. The next type of abnormal pulse is alternance. So this is like there will be an alternate strong and weak pulse which is of equal interval. That is the diastole and the systole. That is a weak pulse. Mostly it is seen in cases with left ventricular failure or patient with hypertension or any sort of aortic regurgitations or prolapse. The sixth type of pulses by Gemini. So from the clue word by means two. So here there is a weak pulse, and then you can see the weak pulse earlier followed by a strong pulse. So here there is a strong pulse, then there is a weak pulse. Again followed by that you have a strong pulse, weak pulse. So this type of mechanism which is being shown on the monitor, we can put it under the classification of pulses by Gemini. So mostly seen in cases of any peripheral vascular problems or might be any aortic problems. Next, you have pulses paradoxes. So, here the intensity of the pulse is totally reduced during inspiration at least 10 mmHg. So, during inspiration, the systole and diastole is totally getting down. Then, again, during expiration, it's going to near normal. Again, there is a depression. So, mostly seen in a case of patient with cardiac tamponade, pulmonary embolism, pulmonary disease, or any sort of pericarditis or pregnancy. Last but not least, you have two, that is the pulses Taurus D points and water hammer pulse, or you call it as Watterson's pulse. So in pulses Taurus D points, you have weak and small pulse, which is very later heard, slow and rising, mostly seen in case of any aortic stenosis. And in case of a water hammer pulse, the pulse is very much bounding, very rapid, that is more than 100, that is increasing, and you can see an example of Corrigan pulse, or you call it as the water hammer pulse, mostly seen in aortic regurgitation. To conclude, so these are the common sites of pulse where we assess. So you have two sites you can assess bilaterally, temporal artery, facial artery which is coming on the jaw line, right and left. You can also do bilateral palpation, but in case of a carotid, do not do bilateral palpation because the patient can go for irreversible blood vessel being reached to the brain. A patient can go for coma. So always you should do unilateral assessment. Next, you can see that is you can feel the pulse brachial artery in both right and left bilaterally. You can also assess the radial artery where it is seen very close to the wrist. You can have a small imaginary line being drawn from the thumb, and where it joins the wrist is your radial artery. Then comes the femoral artery which is placed on the groin, right and left. Then comes the popliteal artery which is found on the popliteal surface, that is just below behind the knee, both right and left. Then you have the posterior tibial artery which is located posterior to the tibial bone. And then you have the last type of artery which we use for pulse assessment is dorsalis pedis artery, which is seen on the foot of the which is seen on the dorsal region of the foot. So by now you are thorough with what are the pulse sites. So if you have any queries, do not forget to ask in the comment box. And thank you for your patient listening. Don't forget to subscribe and like my channel. Thank you.